put people forward on a special table and preserve their posture, and it gives us an idea of balance. And I'm going to do a leg length analysis and measure her leg length this morning. She's doing better overall. And I'm going to work with an acrylic massager and my hands, and I'm feeling with my hands to see if she has muscle tension. And most of us hold tension here in our neck and in our shoulders. And I'm going to work with a little acrylic massager. By the way, if you'd like one of these, you could stop by at my center at 1411 Cremeria Street in East Denver and become a patient. On your second visit, you'll receive a free acrylic massager. But she's got some tension here in the lower back, and I'm going to work on the muscles of the lower back. How does that feel?
It feels really good.
And I'm going to work on her hips in particular, on the muscles there, because she's very active.
It's very smooth, and it's good pressure, and it really feels like it's getting in a lot of different areas of the muscle. So it's really helping alleviate that. So it's also just, it's nice, therapeutic.
When we go out of alignment, when we're out of balance, the muscles get tight. The body wants to heal itself. And one of the things it does, if it's out of balance, the first thing that happens is the muscles contract. And then there's some inflammation. With that inflammation, there's swelling and discomfort, and that's what brings them to my center. And I'm a doctor of chiropractic, and we do an advanced technique. I do traditional techniques as well, but we use a handheld instrument. This is called the impulse device. And I'm going to ask her about her sacroiliac joints, because when we start forward, running, leaping, moving, we use the pelvic area. When we get going, is this or this tender?
That side.
And this can go out of alignment. If you look carefully, one side's more pronounced. Her pelvis is torqued. And we're going to take the torque out of her pelvis and start working the joints back in place. So I'm aligning the sacroiliac joint in her pelvis. And this is right near the center of gravity. The center of gravity is right here. It's forward of my finger about 2.5 inches. And we'll set her right here, because if this is right, the rest of the spine will tend to line up properly. And if the spine's in good alignment, the body has a natural tendency to heal itself. Her pelvis came back on the right side. The vertebrae, the lumbar vertebrae, are out of alignment here. And I'm feeling with my hands, and I can feel swelling in the joints that hold the spine together. And I'm gently realigning the vertebrae, because this is pulled back. Her lower back is torqued or twisted, and the muscles here in the lower back are tight. So I'm going to work the trigger points, the nodules in the muscles with the instrument. So I can move bones back in place with the instrument and correct posture. And I can work on the muscles too with the instrument. I'm feeling with my hands, and she has trigger points here in her pelvis too, because she works very hard. And let them know how that feels, because they're wondering, does chiropractic hurt? How does it feel? How would it feel to get adjusted?
I really like this advanced tool. I find it to be, it allows me to be very relaxed and very receptive to the adjustments, where not fully understanding like how much pressure somebody might use for traditional methods, which I've had before, and I've really found them beneficial. I found this to be very targeted. There doesn't hurt at all. It just feels like somebody's like kind of knocking on a door, right? That level of pressure, and I feel more aligned afterwards.
Wonderful, and you're very in tune with your body, obviously. Yeah. You're a pro.
Extremely.
I'm going to line up her pelvis and line up the sacrum too, in particular, and open up the space between the vertebrae. I'm on the sacrum.
I kind of liken it to like
vertebrae.
A chisel, right? Somebody
like a chisel. All right,
right?
That's good.
Like a good, that level of care. You don't want to break apart the boulder, right, when you use a chisel.
Here we go.
Sculpting.
Interesting. All right, like a sculptor. Maybe a sculptor getting rid of the interference to bring out the
Yes.
figure inside the stone.
Yes.
There are self-healing systems within us. And if we get rid of what's interfering with that expression of her life, of her full potential, she'll do better. And I'm feeling here on her neck, and you can see that to the left it moves readily, and to the right it's locked up. I'm going to make an adjustment here at the base of the skull. And it's very gentle, and she's moving much better after the adjustment. So she has movement on both sides. So we can measure the change right here on the table and see change rapidly. And I'm working on her shoulders, I'm working on the muscles here. Go ahead, turn your face out again.
No.
How did that feel?
I felt really good.
People are concerned about getting their necks cracked. And they mentioned to me that they're reluctant to go to the chiropractor because they're concerned about having their necks cracked. What would you tell somebody like that?
That they're not really cracking it, or you know, they're professional. And so even with this tool, I don't feel pain. I don't feel like a large amount of force being applied. So I can really have the confidence that, like, I'm not going to be injured because, right, that really he's helping put my vertebra back into alignment.
Okay.
And that's really nice.
And most of us have tension in this area of the spine as well, and I'm feeling for inflammation, I'm feeling for joints that are out of place. And where she's locked up, where there's limitation, where there's inflammation, I'm instilling movement. And I'm going to do the same here with computer use. You're probably at a computer terminal right now of some kind, maybe holding a cell phone right now. And that's hard on the spine too. Let's face it, when we're at the computer, our heads are forward, our posture's like this, and we could develop problems in the mid-back area as well. So I'm working with the instrument to take pressure off the nervous system. I'm aligning the vertebrae or backbones and the ribs, and feeling with my hand where the vertebrae are out of alignment or subluxated. Subluxation means bones that are moving too much or not enough, that are interfering with the delicate and sensitive nerves that control our life and determine how much of our potential we'll enjoy, what kind of lives we'll have. I'm going to do some advanced tests. Please lift your